The physicians at the Seattle Prostate Institute pioneered the first modern prostate brachytherapy in Seattle over 25 years ago. Prostate brachytherapy is the placement of radioactive sources into the prostate gland with surgical precision, thereby delivering high doses of radiation and sterilizing the cancer. We're leaders in the field. We teach and proctor other doctors to perform this procedure. We host an annual conference where cutting-edge research is presented. We publish our results in peer-reviewed medical journals. There's a notion that the prostate gland needs to be removed to achieve a cure for prostate cancer, but this is simply not the case. Long-term results from our own institution and experience at the Seattle Prostate Institute show that the results from brachytherapy are equivalent to those of surgery. A patient with early prostate cancer will do equally well with surgery or brachytherapy. The difference lies in the side effects, complications, and the recuperation from the procedure. Brachytherapy is a minimally invasive procedure without cutting, and therefore the blood loss is minimal. The procedure takes about an hour to perform, and therefore the anesthetic risk is minimized. Patients are discharged from the hospital the day of the procedure without a catheter. Patients will often return to work 2 days after the procedure. Patients with open or robotic prostatectomy cannot make these claims. In terms of convenience of brachytherapy and with the equivalent cure rates, the choice is obvious. Patients with intermediate-risk prostate cancer will be treated with a combined approach of external beam radiation with brachytherapy. The external beam radiation component allows for treatment of tissue beyond the prostate gland. Surgery, even with lymph node dissection, doesn't compare. We're using the Calypso 4D localization system in the treatment of intermediate-risk prostate cancer patients. The Calypso transponders allow for real-time tracking of the prostate gland during external beam radiation treatment. This GPS for the body allows us to detect if the prostate gland moves outside of our radiation fields due to normal physiologic motion. An example is if the bladder fills, it can push the prostate away. This technology allows us to deliver the radiation with more accuracy and thereby minimizing collateral organ injury. Historically, we have delivered the external beam radiation component first, followed by the brachytherapy. Recently, we have switched to deliver the brachytherapy first. This allows us to calculate the doses from the seed implant and therefore intelligently augment certain areas with a high degree of precision using Calypso-guided intensity-modulated radiation therapy. Thus, we have a tailor-made radiation plan specific to the patient's anatomy and disease status.